Well, hello there. It's Dr. Brian, Neuropathy Core Health. And today we are going to go over the primary difference between Lyrica and gabapentin. Fascinating subject. Won't you agree? If you have peripheral neuropathy, it's one you should listen to. All right, let's get started. Well, the first thing you should know is gabapentin is Lyrica. I'm sorry, gabapentin is Neurontin. Sorry. So you have Lyrica's pregabalin, gabapentin is Neurontin. And what happens is, okay, listen, you have millions and millions of people with pain. They don't know what to do with these people. And they figure out that Lyrica and Cymbalta are both basically your anticonvulsants, but they use them for nerve pains because it blocks the nerve channels, um, that go up through the spinal cord to the brain and then back down. So that's the basic, And so they're called anti-epileptics. You know, what happens is, like many medications, it's not really understood how they work. They don't always work all the time either. So that's one of the things you got to be aware of. What they try to do is they affect neurotransmitters at the synaptic junction where mess with calcium. Okay, the calcium comes into synapse, the site where you have these neurotransmitters, and it produces an effect. Okay, so the neurontin is going to be one where you have interaction with the calcium channels in the brain and improves how well the brain cells respond to GABA. Whole other topic about GABA. GABA is important here when it comes to pain. Now, Lyrica also works on the calcium channels to make it easier for GABA to release. Okay, so that's so release Lyrica releasing the GABA, Neurontin making it cells respond faster. So what they try to do is they both try to calm overactive pain pathways. And they're equally effective in both cases, but some like Neurontin seems to be more effective at lower doses than higher doses. You would think you take more, it's going to be better, but so they actually sometimes have you take it that 3 times a day, whereas the other one they have you take it once. So it depends what your doctor's going to put you on. And if one doesn't work, he's going to put you on the other. So what happens is Neurontin is absorbed more slowly, so it may take a few hours to begin working. So first, that's probably what you would take first thing in the morning to hopefully not have the pain. But pain's your body's way of saying something's wrong. You're shutting that off or going the back door. Listen, it's great to get out of pain, but what are you really accomplishing here? Lyric is just clearly absorbed more quickly. It starts to work faster than Neurontin. It sometimes as fast as 25 minutes after you take it. So they'll give you the pros and cons. If you have peripheral neuropathy, your chances are you're going to be on Lyrica or Cymbalta. The effectiveness. Will they work for everything? Okay, Lyrica has been shown up to a 50% decrease in pain scores, has also shown improvements in daily functioning and mood. They also will, it's not a bad thing, and they come with the vague, if a 50% decrease is significant, but it's obviously not batting it out of the park because up to. So it's kind of a vague answer. Like, yeah, we might be able to help, we might not be, but you only get the best odds are only 50% of the time will you be able to have that. So with Neurontin, we have a little bit different. Neurontin is showing a 30 to 40% decrease in the pain scores. So it's kind of a little bit, not as effective. I get the fly chasing me around the office here. So you probably should be aware of here is side effects. The side effects are numerous, okay? Medications, both these medications, you have dizziness and drowsiness. Less common side effects, agitation, teeth grinding, but weight gain, not a good thing. Side effects decrease over time, and rarely these medications may cause suicidal thoughts. Again, not what you really want to have happen, but it is what it is. Side effects more common with Neurontin include ataxia, which is kind of a serious one. it's with jerky movements, double vision and other eye movement issues. So not a good thing to have happen. You kind of, the idea is what can you do? And that's what neuropathy of core health is. Neuropathy of core health is a program to drive oxygen, um, rebuild the nerves, and to get the right amount of nutrients into that area to make a change and more of a lasting change. I mean, you can't always get rid of the underlying comorbidity, but you certainly can make a difference with the quality of a person's life. So some of the side effects with Lyrica is like edema, swelling, weight gain. I mean, traditionally you are going to gain weight with Lyrica and tremors. So the interesting thing about Lyrica is it's a Schedule 5 controlled substance. So it means it's going to have, it can be abused. And so it's kind of a thing you got to be considered. People get hooked on Lyrica. You don't always hear about it, but it is possible. And the other thing too is nowadays Neurontin is inexpensive, but Lyrica can be quite expensive. And we all know the drug companies want to make their money, but the Neurontin is very, very much cheaper. And interesting enough, it's a little bit more effective, whereas 50% effective, up to 50% effective, where the other one's 30 to 40%. So let's sum it up. Lyrica and Neurontin are two medications used for treatment of neuropathic pain. They're anti-epileptics. We originally used to treat seizures, but there's a lot of the uses. The other uses are post-herpetic neuralgia, which is when you have chickenpox as a kid. As you get older, it turns into herpes. And you can have pain anytime, a nerve pain, serious nerve pain. Fibromyalgia is another one it's used for. Fibromyalgia is very misunderstood by just about everybody. So it helps by calming the pain signals in the brains. Neurontin takes a little longer to begin working and doesn't work as long as Lyrica. Therefore, it must be taken more frequently, but it's less expensive. The side effects kind of the same, but Lyrica with a little bit more of the weight gain, and Neurontin as far as issues with the vision and eye movement. So, what are you going to do? Well, my suggestion is you give us a call, 203-656-3636. You come in, you get an examination. We really need to see how bad the nerves are. If the nerves are really that bad, there is nothing we can do here to help you. However, if you pass the test and the examination, there are things to help you. We'll bring that to your attention. So, Dr. Brian McKay, Neuropathy of Core Health, located 551 Post Road, Darien, Connecticut. We've got a lot of experience treating these conditions. Very not your normal type of a way of treating it, because these medications are not going to do anything. The medications are going to work on the pain, but it's not causing it. So you've got oxygen issues, anemia, hypoxia, metabolism issues as far as too much sugar in the bloodstream, eating away the nerve itself, killing the nerve, the covering on the nerve. And this is something that we're going to do to bring your life back. So if you want to get your life back, give us a call. I'm Dr. Brian McKay, Neuropathy of Core Health, 203-656-3636. Hope to help you. Hope you learned a little bit about Lyrica versus Neurontin. Thanks again.